Yes. Well, thank you very much to everyone who enabled us to come together. Again, that was not easy, and we appreciate all the organizational efforts that went into this. I'm going to speak briefly about personal health, planetary health, and how that relates to olive oil production and consumption. Next slide, please. From a health standpoint, okay, and I go. There, perfect. Thank you. Okay, one of the huge health challenges that we're facing around the world is the increase in rates of overweight and obesity. This on the top is high-income countries, and the low part of the figure is lower and middle-income countries. And so both in rich and poor countries, this epidemic of obesity is continuing and unabated. This has huge challenges biologically and to personal health. I think probably the greatest single challenge is the epidemic of diabetes that follows very quickly the epidemic of obesity. On the left, you can't see the words very well here, but diabetes was about 30 years ago, number 6. It's already moved up to number 3 in terms of the global burden of disease. And of course, the top two are coronary heart disease and stroke, but diabetes is one of the major underlying causes of heart disease and stroke, and of course, kidney failure, loss of vision, loss of limbs, kidney disease, so many other things. So the consequences of this combination of obesity and diabetes increasing around the world is hugely important, and the trends are continuing upward. And of course, the consequences of this still take time to evolve, but we're starting to see in the United States, actually, even before the pandemic, that life expectancy has been going down. This is accounted for by several factors, including addiction and overdosing from drugs, but the epidemic of obesity is one of the major drivers of this decline in life expectancy. And unfortunately, many other countries are probably on track to follow this United States in terms of declining life expectancy. And of course, the pandemic added to this. And I put this up here to make the point also that just the average numbers don't tell the whole story, because there are huge differences, disparities among groups. That the number of years lost in the pandemic was 5 years for Latinos, about 1 year for white Americans, and about 3 years for African Americans. So the epidemic of obesity, diabetes, and now coronavirus are affecting the population very unequally, and exacerbating the large differences that already existed. Another huge challenge, of course, facing humanity as a whole is climate change. And I think everyone knows that, and that's one of the reasons for people wanting to come to a conference like this. And the issue isn't just that we're seeing increases in temperature, but there's an acceleration in increasing temperatures. It's not a linear relationship. And we've entered a vicious circle now where the increasing temperatures are melting the permafrost and Arctic ice cap, and that causes release of more methane, and that speeds up more warming, which the circle goes around and around. And I think we all understand is close to spinning out of control. In terms of the Mediterranean diet and olive oil, I think it's fair to say that the modern era started with the publication of the 7 countries study by Ansel Keys and colleagues. This looked at 14 different populations in 7 different countries, and for the first time accounted for rates of coronary heart disease with a standard definition, both incidence and mortality. And most importantly, there was about a 10-fold difference in rates of coronary heart disease from the top, which was up here, Finland, and at the bottom, which was Crete. And the question was, why are there such important differences? And this figure was shown time and time again to say there's a very strong association between saturated fat intake and coronary heart disease, the #1 cause of death now in almost every country worldwide. This was used to say, well, we should reduce total fat in the diet because there was a correlation between total fat and saturated fat. But unfortunately, most people ignored this other finding from the 7 countries studying looking at total fat in coronary heart disease. And of course, what you can see here at the highest fat intake, you have both the highest risk areas, Finland, and the lowest risk area, which was Crete, which really we now understand wasn't perhaps so clear at that time that the type of fat was extremely important, that dairy fat or butter fat up at the top in Finland and olive oil at Crete and other Mediterranean countries was another possible explanation for these huge differences in heart disease rates, or partial explanation at least. Actually, I'm from the northern part of that figure, the upper part of that figure, because the United States has mostly inherited, at least until recently, Northern European culinary traditions based on dairy fat and meat. And this is actually our family farm. It's been for many generations, and my grandparents and their parents milked cows there. And so diet was, at the center of diet was butter and meat and eggs. Olive oil is something I never experienced till I was in my mid-20s. And I think everybody in this room knows much more about olive oil than I do. So I'm going to mostly ask questions here in my introductory talk rather than try to provide answers. And one of the questions is, can we separate the benefits of the Mediterranean diet from those of olive oil in our research? And I think that's still a pretty good question. You can't see the specific studies here from this meta-analysis, but in the red box there, it does show that olive oil is overall related to lower risk of cardiovascular disease. This is a summary of many different studies. But most of those studies didn't actually control for other aspects of the Mediterranean diet besides olive oil. In a few studies more recently that has been done. This is a study from our own cohorts, but conducted by Dr. Gauch Ferrer, visiting us from Spain. And in this study, she did look at olive oil in relation to cardiovascular disease, found lower risk with higher olive oil consumption after controlling for the other aspects of the Mediterranean diet. And much more recently, just in the last few months, she's also published a paper looking at cardiovascular disease, and again, found that there was still an inverse association with olive oil after controlling for the other aspects of a Mediterranean diet. So it does seem like there's likely to be an independent effect of olive oil on cardiovascular disease and type 2 diabetes and now total mortality as well. Then the question is, what is responsible for this benefit of olive oil? And we know that olive oil is primarily containing healthy unsaturated fats, particularly monounsaturated fats. That reduces LDL cholesterol, and that we know is good for cardiovascular disease. But of course, olive oil contains polyphenols in high amounts, squalene, other related compounds, vitamin E. And the question has been asked many times, what are the contributions of these minor components, or is most of the benefit due to the monounsaturated and some polyunsaturated fat as well? So that, I hope, is a question we'll come back to, and I know some of the speakers will be giving us more detailed about that information. So that's the question, how much of the benefit of olive oil is due to its fatty acids versus the minor constituents? And Dr. Estruck and others here will surely give us more detail about the Mediterranean diet from the very famous, now famous PREDIMED study conducted in Spain. We'll hear more details, but here, the Mediterranean diet plus olive oil or Mediterranean diet plus nuts gave about the same reduction in coronary heart disease, cardiovascular disease, compared to the control group. So that literally would tend to say it was probably more the monounsaturated fat that was responsible, but we'll hear about other possible interpretations of that. That's not the only interpretation. Another question, is olive oil better than other plant oils? Because around the world, olive oil is still a fairly modest part of the total fat consumed, even though the consumption has been increasing. And these other plant oils seem to be pretty healthy as well. Again, many probably can't see the words here, but this is what we call a substitution analysis. In our large cohort studies, again, this from Dr. Gausch-Ferrer, and here she's comparing olive oil to other types of fat. We can see that in particular, olive oil replacing butter, there's a clear inverse association. Olive oil replacing margarine, and inverse association with olive oil being better. But on the bottom is olive oil compared to other plant oils like soybean oil and canola oil. And there it's not so clear that there's a difference. They both seem to be beneficial. And I think that's a practical in question for reasons that I'll come back to in a moment. And of course, in the production of olive oil, in the centrifugation process, we separate the oil, and we have an aqueous phase, but that aqueous phase has a lot of polyphenols in it. And of course, if they're so good, should these be concentrated and perhaps even sold as supplements? I pose that as a question. And very importantly, and hopefully one of the results of this meeting will help answer the question, what studies could be done to better understand the role of olive oil in health? What can we do to move the science forward in this area? And then I want to mention just a few more questions about the ecological or environmental benefits of olive oil production. And we know that olive oil can be produced sustainably. Just as we've heard, it's been produced for thousands of years. This is a tree actually from Mount Athos in Greece, and that's well over 1,000 years old. I clearly see continuing to sequester carbon even after that time while it's producing beneficial olive oil. So some of these questions are, what does the yield per area for olive oil compared with production of other oils? And we are going to be challenged with feeding about 10 billion people by 2050, and it's going to be a challenge to produce enough healthy food. So in terms of production per area, how does olive oil compare? And again, we have experts with us who will inform me and hopefully many others about this question. What does life cycle analysis show for various production modes, including traditional, mixed, and industrial production of olive oil? In other words, what is the carbon sequestration and carbon production effects of olive oil production by these different means? Then what is the global potential for commercial olive oil production? That olive oil was banned by Spain from many parts of the world, particularly Latin America during the colonization period. And it's pretty clear there are many parts of Latin America and I think Africa too that could produce olive oil but aren't yet. And should we be trying to increase olive oil planting and production in those areas? And is there a greater role for olive oil in subsistence agriculture? We know for many families in low-income areas, olive oil has provided a healthy source of calories, like in the Greek tradition, up to 30% of calories from olive oil in a context that's reliable from year to year, generally reliable from year to year. And should we be encouraging, not for commercial production, but more having a few trees to produce for individuals enough olive oil to provide healthy sources of calories? And then what about the different production modes? The traditional production of olive oil was and still is fairly labor intensive, and that if we pay labor fairly, that makes the price fairly high. And in recent years, there's been a lot of investment in commercial industrial olive oil production. This machine harvests one tree in about 15 seconds, I understand, compared to how long by traditional methods. And by reducing labor costs, that can cut the olive oil costs quite a bit. So one of the practical challenges is this. When I went last week to a local store to look at the cost of different oils, their best olive oil was about about $10 per liter on the left there, but some of the Tuscan olive oils will cost 2 and 3 times that much and with traditional production methods. Then you could buy an olive oil for about $6. Almost for sure that was produced with these industrial production means. And I must say, I tried some of those. In fact, they are very good. And we have somebody from Davis who will talk about that. And then finally, what is the value in preserving a healthy, sustainable culture that has great value? And despite the cost, in the United States, production of olive oil has gone up about tenfold over the past 30 years. So there is still last slide here. Last question, should there be more research centers? That's it. Thank you.